Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top headlines. CDSU confirms WHO alert on contaminants in Punjab-made cough syrup. A report of Central Drug Standard Control Organization has confirmed that a cough syrup being manufactured by a Dera-Bassi-based unit was contaminated. Recently, WHO had issued an alert regarding the cough syrup. In a report sent to the Punjab Food Drug Administration, the CDSCO found that the cough syrup was contaminated with diethylene glycol and ethylene glycol. The contaminants can cause nausea, diarrhea, abdominal pain, or even death in adverse cases. Similar findings were shared by WHO with the Government of India. MBBS interns in Kerala upset with Meagre stipend of ₹4,000 to ₹10,000. Health activists seek redraft of an MC CRMI regulations. Amid the ongoing survey of the NMC regarding the stipend paid to MBBS interns and PG resident doctors at private medical colleges, the intern doctors in Kerala have expressed their disappointment with the private medical colleges for paying Meagre amount of stipend. In around 19 private medical colleges across Kerala, the MBBS interns are getting a stipend ranging from ₹4,000 to ₹10,000 per month. The effective amount of stipend gets further reduced since these students are required to pay a huge amount of money for their accommodation. Regarding the NEET and MC DGHS told to include doctors with disabilities in special committee framing guidelines for PWD candidates. In the recent order, the Court of Chief Commissioner for Persons with Disabilities has directed the DGHS and the MC to include doctors with disabilities in the expert committee constituted to address the problems faced by NEET UG and PG applicants. This direction was issued by the court while disposing of a complaint by disability right activist Dr. Satyendra Singh. The complaint raised the issue relating to the double examination of the candidates who have successfully qualified NEET exam. In an earlier order, the court has also recommended increasing the facilitation centers to ensure that Divyang candidates do not have to face unnecessary problems in evaluation. The order further read that furthermore, till centers cannot be increased, government medical colleges can be authorized to conduct such evaluations. India will get its own index to quantify heat impact next year. India will launch its own composite index next year to quantify the impact of heat on its population and generate impact-based heat wave alerts for specific locations, IMD has said. The IMD began issuing an experimental heat index for different parts of the country last week, taking into account air temperature and relative humidity to determine how hot it really feels. This year, India experienced its hottest February since record-keeping began in 1901. However, above normal rainfall in March kept temperatures in check. March 2022 was the warmest ever and the third driest in 121 years. A report by the McKinsey Global Institute warns that if this continues by 2030, the country could lose between 2.5% to 4.5% of its gross domestic product per year. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.